This figure shows the structure of spleen. It shows the artery and vein entering the spleen, the red pulp and the white pulp, the germinal center and marginal zone are all shown. See the earlier figure structure of spleen shown. The spleen is similar to the lymph nodes, except that blood instead of lymph flows through the tissue spaces of the spleen. Small arteries penetrate from the splenic capsule into the splenic pulp and terminates in small capillaries. The capillaries are highly porous, allowing whole blood to pass out of the capillaries into cords of red pulp. The blood then gradually squeezes through the trabecular meshwork of these cords and eventually returns to the circulation through the endothelial walls of the venous sinuses. The trabeculae of the red pulp and venous sinuses are lined with vast numbers of macrophages. This peculiar passage of blood through the cords of the red pulp provides an exceptional means of phagocytosing unwanted debris in the blood, including especially old and abnormal RBCs. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Inflammation, role of neutrophils and macrophages. Inflammation. When tissue injury occurs, whether caused by bacteria, trauma, chemicals, heat, or any other phenomenon, multiple substances are released by the injured tissues and cause dramatic secondary changes in the surrounding uninjured tissues. This entire complex of tissue changes is called inflammation. Inflammation is characterized by the following. 1. Vasodilation of the local blood vessels with consequent increased local blood flow. 2. Increased permeability of the capillaries, allowing leakage of large quantities of fluid into the interstitial spaces. 3. Often clotting of the fluid in the interstitial spaces because of increased amounts of fibrinogen and other proteins leaking from the capillaries. 4. Migration of large numbers of granulocytes and monocytes into the tissues. And 5. Swelling of the tissue cells. Some of the many tissue products that cause these reactions are histamine, bradykinin, serotonin, prostaglandins, several different reaction products of the complement system, reaction products of the blood clotting system, and multiple substances called lymphokines that are released by sensitized T cells, part of the immune system. Several of these substances strongly activate the macrophage system, and within a few hours, the macrophages begin to devour the destroyed tissues. At times, however, the macrophages may also further injure the still living tissue cells. Walling off effect of inflammation. One of the first results of inflammation is to wall off the area of injury from the remaining tissues. The tissue spaces and the lymphatics in the inflamed area are blocked by fibrinogen clots so that after a while fluid barely flows through the spaces. This walling off process delays the spread of bacteria or toxic products. The intensity of the inflammatory process is usually proportional to the degree of tissue injury. For example, when staphylococci invade tissues, they release extremely lethal cellular toxins. As a result, inflammation develops rapidly, indeed, much more rapidly than the staphylococci can multiply and spread. Therefore, local staphylococcal infection is characteristically walled off rapidly and prevented from spreading through the body. Streptococci, in contrast, do not cause such intense local tissue destruction. Therefore, the walling off process develops slowly over many hours, while many streptococci reproduce and migrate. As a result, streptococci often have a far greater tendency to spread through the body and cause death than staphylococci, even though staphylococci are far more destructive to the tissues. Macrophage and neutrophil responses during inflammation. Tissue macrophages provide first line of defense against infection. Within minutes after inflammation begins, the macrophages already present in the tissues, whether histiocytes in the subcutaneous tissue, alveolar macrophages in the lungs, microglia in the brain, or others, immediately begin their phagocytic actions. When activated by the products of infection and inflammation, the first effect is rapid enlargement of each of these cells. Next, many of the previously sessile macrophages break loose from their attachments and become mobile, forming the first line of defense against infection during the first hour or so. The numbers of these early mobilized macrophages often are not great, but they are life-saving. Neutrophil invasion of the inflamed area is a second line of defense. Within the first hour or so, after inflammation begins, large numbers of neutrophils begin to invade the inflamed area from the blood. This invasion is caused by inflammatory cytokines, example tumor necrosis factor and interleukin 1, and other biochemical products produced by the inflamed tissues that initiate the following reactions. 1. They cause increased expression of adhesion molecules such as selectins and intercellular adhesion molecule, that is ICAM1, on the surface of endothelial cells in the capillaries and venules. These adhesion molecules, reacting with complementary integrin molecules on the neutrophils, cause the neutrophils to stick to the capillary and venule walls in the inflamed area. This effect is called margination. This picture shows a free-floating neutrophil on the left inside a blood vessel. The next neutrophil to the right is adherent to capillary wall. This neutrophil is in the margination stage. Then it undergoes diapedesis and migrates to the tissue and attracted by chemotactic forces. This picture shows the 4 stages of neutrophil migration to an inflamed area. 1. On the left is the free-rolling neutrophil. 2. Adherent neutrophil to the capillary wall on the right. And 3. Neutrophil undergoing diapedesis. And 4. Neutrophil in the inflamed tissue, which is migrated and attracted to the chemotactic forces. See figure migration of neutrophils from the blood into inflamed tissue. This is shown in 2 pictures. One, the movement of neutrophils by diapedesis, shown earlier, and in more detail in the second picture, migration of neutrophils from the blood into inflamed tissue. 2. They also cause the intercellular attachments between the endothelial cells of the capillaries and small venules to loosen, allowing openings large enough for neutrophils to crawl through the capillaries by diapedesis into the tissue spaces. 3. They then cause chemotaxis of the neutrophils toward the injured tissues as explained earlier. The entire process of neutrophil or other substances and cells such as monocytes translocation through the capillaries into the tissues surrounding them is called extravasation. The specific passage of blood cells through the intact walls of the capillaries is called diapedesis. Although this term is often used interchangeably with extravasation when discussing blood cell movement through the capillaries into tissues. Thus, within several hours after tissue damage begins, the area becomes well supplied with neutrophils. Because the blood neutrophils are already mature cells, They are ready to begin their scavenger functions of killing bacteria and removing foreign matter immediately. Acute increase in the number of neutrophils in blood, neutrophilia. Also, within a few hours after the onset of acute severe inflammation, the number of neutrophils in the blood sometimes increases fourfold to fivefold, from a normal 4 to 5,000 to 15 to 25,000 neutrophils per microliter. This is called neutrophilia, which means an increase in the number of neutrophils in the blood. Neutrophilia is caused by products of inflammation that enter the bloodstream, are transported to the bone marrow and act there on the stored neutrophils of the marrow to mobilize these into the circulating blood. This makes even more neutrophils available to the inflamed tissue area. Second macrophage invasion into the inflamed tissue is a third line of defense. Along with the invasion of neutrophils, monocytes from the blood enter the inflamed tissue and enlarge to become macrophages. However, the number of monocytes in the circulating blood is low. Also, the storage pool of monocytes in the bone marrow is much less than that of neutrophils. Therefore, the buildup of macrophages in the inflamed tissue area is much slower than that of neutrophils, requiring several days to become effective. Furthermore, even after invading the inflamed tissue, monocytes are still immature cells, requiring 8 hours or more to swell to much larger sizes and develop tremendous quantities of lysosomes. Only then do they acquire the full capacity of tissue macrophages for phagocytosis. After several days to several weeks, the macrophages finally come to dominate the phagocytic cells of the inflamed area because of greatly increased bone marrow production of new monocytes, as explained later. Macrophages can phagocytose far more bacteria, about 5 times as many, and far larger particles, including even neutrophils and large quantities of necrotic tissue, than can neutrophils. Also, macrophages play an important role in initiating development of antibodies. Increased production of granulocytes and monocytes by bone marrow is a fourth line of defense. The fourth line of defense is greatly increased production of granulocytes and monocytes by the bone marrow. This action results from stimulation of the granulocytic and monocytic progenitor cells of the marrow. However, it takes 3 to 4 days before newly formed granulocytes and monocytes reach the stage of leaving the bone marrow. If the stimulus from the inflamed tissue continues, the bone marrow can continue to produce these cells in large quantities for months and even years, sometimes at a rate of 20 to 50 times normal. So, dear viewers, this is the end of part 3 of the 4-part series on the WBCs, granulocytes in the Medicine for Anyone in the YouTube channel. Thank you for watching the video.